Hello, my name is Deborah, and today I'm going to talk about X-ray image quality. It's important for radiographers to know what factors affect our images because it's our job to produce high-quality diagnostic X-ray images. So the factors we're going to talk about are our primary factors, which include the basic KVP, mass, SID, OID, and position, characterization such as contrast, resolution, noise, and the matrix, patient factors like body habitus, patient motor skills, cooperation, and physical condition, as well as the use of tools, which is basically grids, filters, sponges, etc. Now there is contrast and KVP, which go hand in hand. So KVP stands for kilovoltage peak, and that's basically the highest possible energy level that a photon can achieve, which is the intensity of the beam. And different tissues attenuate the radiation differently, and that helps produce a contrast. So in order to provide you with a visual diagram, I'm going to show you the different types of tissues and what it would look like. So example, bone and fat and air. As you can see, the air is right here in the lungs where it should be, and then the bone is slightly more white, and then we have the tissue around here where you can see the tissue of the arm, and that helps produce an image where we can see the different structures and help provide a better image in order to help the radiologist, doctor, whoever is looking at the x-rays at the moment. Now, KVP, as you can see, if you underexpose it, it's going to look like this. And the reason why it's going to look like that is because if photons don't have enough energy to pass through a tissue and reach an image receptor, it will basically be absorbed by the body, which creates a haziness to it. Then we have our overexposure, which is too much KVP and too much contrast, which basically takes over the image and you lose some of the diagnostic information. So here's an optimal image to kind of compare the two. Then we have mass, which stands for milliamperage per second, and that determines the quantity of the X-ray beam. So basically how many photons are reaching the person and for how long. And mass is affected by motion, and I'll explain that to you in a bit. So for SID and OID, so source to image distance, chest x-rays are taken at 72, abdomens usually at 42. The reason is we want to stay as true to the body of interest as possible. It's not going to be perfect, but we're going to try to stay as much as we can. Because if you look at these three images to the screen right here, we have our regular bone, regular sized, then we have one that's shortened and one that's elongated. And this has to do with SID as well as OID. So remember in X-ray, like when you're taking an X-ray of the chest, you always want to put the patient's left side to the image receptor because of the heart. The more away it is from the image receptor, the more magnification the heart is going to get. And that can, I wouldn't say ruin an image, but it can provide inaccurate diagnostic information, or it's really just an inaccurate image. And that's the OID, which stands for object to image distance. So you kind of see how these two go hand in hand. Now noise, as I mentioned before, it involves photons that are too weak to pass through the body and reach the image receptor. So when that happens, as you can see right here to the left, this is an optimal image, while to the right you can see that's a little hazy. That's because the improper technique was used and there was too many photons that didn't reach the image receptor. And that's what we call quantum noise, is the haziness and actually a little bit graininess that I've mentioned. Whoops, hold on one second. Alright, contrast, resolution, and the matrix. So, I talked a little bit about contrast, but I didn't really go into detail. But we have the short gray scale right here, and as you can see, there aren't that many shades of gray. But when you look at the long gray scale, there are quite a bit of shades of gray, and that helps with the contrast. Because the more contrast there is, like I mentioned, the more difference between the anatomical structures there is, and that helps with diagnostic information. And because there's more shades of gray, that means there's more pixel depth in the matrix, and that increases the resolution. So the more shades of gray, the better there is for the contrast. Then body habitus and conditions. So if you're to look right over here at the hypersthenic body structure, you can see it's a lot larger than, let's say, a hyposthenic. That's because there's a lot more tissue and fat than there is in a smaller sized patient. So, for example, KVP, it's going to be increased, otherwise a proper diagnostic information will not be achieved. If you look over at the asthenic, you can see that it's quite an elongated torso where you can't even see the costophrenic angles. So those are some of the factors that will affect the image quality, is the body type, because you have to set your KVP and mass depending on the body type. For example, for a kid, you definitely wouldn't use a high KVP or mass. Then there's actually conditions like osteoporosis, which is basically found in older patients, and you would use a lower KVP for that because the bone tissue is not as dense as it would be in a younger, healthier patient. So that's why take age into consideration, because you could have two hyposthenic patients, same weight, same size, whatever, but one's 20, the other one is 45 or so. You're not going to use the same KVP. And then there's older individuals with tremors. They can't help it. That's involuntary motion. So what you're going to try to do to get around that is to lower your mass. Because with a lower mass, there's a higher chance that they'll be able to catch an image in between tremors. Like, for example, when you're trying to take a picture of a fast-moving object, you're going to go into sports mode on a camera. And that way it takes pictures really rapidly, and that increases the chances of getting a clear image of the moving object. And that's the same concept that applies to radiography. Same thing for kids. Some kids do not want to cooperate, and you have to resort to using a lower mass. I mean, their bodies are tinier as well, but that's kind of another point. Then there was a study on radiation dose on pediatric patients. So there was a study in Malaysia where they used children ranging from 1 month to 15 years old, total of 109 patients, and determined the best technique to use on said patients. So kind of like how AEC is for us, that's what they were trying to achieve. So when they took an x-ray of the kid's chest, which was either AP or PA or even both, they took into account the factors that were used, the sex, age, condition, and wrote that down to keep documentation of each. And the reason why the study was started was because the dangers of radiation was finally starting to come into people's attentions, really. It was that radiation can harm the body in such a way that it can prove devastating. So that's why the study was being done. And the Commission of European Communities recommended a 60 to 80 kVp for children 0 to 15. Of course, the variation in kilovoltage was within 5 kV, while the variation in tube output did not exceed 3%. And there's a link to the study, but also provided in the description box. Now grids, you know how I mentioned earlier that some images can produce noise? Well, that can be due to the high intensity of the beam KVP. Well, aka KVP. So grids help alleviate some of that because there's lead strips in front of the image receptor that are going to catch the weak photons before it reaches the body. So that way they can't be attenuated. And they can either be linear or crossed. And preferably you would use grids on body parts that are thicker than 10 centimeters. So skull, abdomen, chest, etc. So I wouldn't suggest using it on hands or wrists because that's just unnecessary exposure because you will have to raise the KVP slightly because of the grid absorbing some of that radiation. So we have stationary grids, which have lead strips that are parallel to each other, or have lead strips that are angled towards each other. And the stationary grids sometimes do create grid lines, but there was a way around that where they actually created moving grids, which does exactly what it sounds. It moves. Then we have right here the parallel, which you can see how it lets the beam in through to reach the target. Then we have the focus. As you can see, they're more angled. And so the parallel will just let the primary beam simply pass through. And then we have the focus, which is going to be angled towards the grid focus and allow more of the primary beam to reach the target. Then, as you can see, we have with a grid and without. And you can see how much of a difference it makes in between the two. Then compensating filters. These are filters that help level the different densities. As I mentioned before, different tissues have different densities, and it helps kind of have an even playing field so that all the tissues are visible. So these are just some of the examples right here. And actually some of the filters, prop the patients for, let's say, a horizontal beam lateral hip that requires both the proximal and distal portion to be examined, but there's a lot of different densities in between, so that's where they would come in hand. So we got the boomerang compensating filter. As you can see, it's named because it looks like a boomerang, and this is kind of what it would look like when it's evening out the shoulder. So it really just balances out the density of the soft tissue during the exam. And it's not only, for the shoulder, it can use for the lower maxilla, T1 to T3 vertebrae, and the patella, whatever it needs to be used for. Then also, here's another image where you can see with the filter and without how well it evened out the densities. And we have the Trill filter. And it's typically used for chest radiographs. The thicker parts of the filters compensate for the less dense parts of the peripheral lungs. And here's a little diagram to show you kind of what it's talking about. Or rather, what it's used for. And then we have the wedge filter. Very similar to the filter that I showed before. But the wedge is usually used for other body parts. The common uses are horizontal beam hips, the distal part of the femur, and of course the AP foot. And as you can see, the thicker part of the patient, it's a lot lower, while the thin part has a higher angle to it. Then the wedge filter, you can see without, with. Immobilization devices. You can use these to hold difficult positions because, as all of you know, holding your pinky out for a long extended time can be difficult, especially for older patients with tremors and whatnot. It can be difficult to uphold that. As you can see, here's a perfect oblique hand right here where it shows. And then immobilization devices that can help prevent motion, voluntary and involuntary, help align, as you can see, And that's about it. Well, thank you for being here with me.